Thank you so much for the organisers for inviting me, and for the sponsors, of course, who make it possible to have this wonderful conference. And thank you to the preceding speakers who have really helped set the scene for me for my talk, which will also lead into the next session around what I would like to call intense sweetness, as you'll see. So I don't have any relevant conflicts of interest to declare, so I'll start talking about the main topic. So first of all, I thought it was important to get the way we talk about these particular sweeteners in a rational way, so that we're all talking off the same page, basically. And you'll probably all recognise this table. Yep. This is the 2007 version of the WHO guidelines, but I think it was the 1998 one that Tom Oliver and a few others put together. So, and you'll see, of course, that we have sugars listed there, but there's also some oligosaccharides. The sugars, of course, we've talked about a lot so far this conference, the mono and disaccharides. We haven't really talked about the polyols, and I think that's perhaps something we can talk about later, or maybe in the final session. And I've put a question mark for oligosaccharides because, of course, there are some that are sweet. And back in the peak of sugar hysteria, in Australia, there were certain activists suggesting that we cut out all fructose and have rice syrups and other things that, of course, are quite high in these oligosaccharides. And they were sweet, and they were saying, oh, quit sugar, but then they were saying have these instead. So it was, well, the irony was lost on them, but not on us. So we'll talk about them a bit later. Non-caloric sweeteners, of course, the consumer considers those to be artificial sweeteners. That's all they ever talk about. Regulatory bodies in general talk about intense sweeteners, and interestingly, the FAO people talk about intense sweeteners, but as you're probably aware, the WHO people actually call them non-sugar sweeteners, despite the fact that they're related organisations, and I think that's a source of confusion as well. So we'll try and get into that. And yes, the oligosaccharides do include maltodextrins and also, I need my glasses, polydextrose as well. So important to keep that in mind. So I mentioned yesterday Codex Alimentarius, and I'm not sure if everybody is aware of this body. So I thought I'd put it up there just to get us all on the same page again. And it is the International Organisation for Food Standards. And I think that's very important because when you look at the food standards around the world, they're loosely following this. They don't follow it religiously, but they loosely base their regulations on this particular body. And what we were talking yesterday about lobbying to get GI labelling, and even fibre, not fibres, sorry, the other way around, fibres, not fibre, into the Nutrition Information Panel. We should probably be talking to this particular body who are based in Rome about that, because it will filter through to the other countries around the world if we do that. So first of all, caloric sweeteners, how do we define them? Sugars, obviously, are the most famous of them all. And Codex Alimentarius does have a paper which is on nutrition labelling in general. So it's CXG2 1985. It was first written in 85, but it was last updated in 2024. So this document is updated regularly. And of course, it underlines what we have in our nutrition declaration in the European Union, nutrition information in Australia and New Zealand, and nutrition facts in North America. So they're all based loosely on this. Of course, the key components: energy, protein, available carbohydrate. I thought that was interesting, given North Americans don't actually label available carbohydrate. They're labelling total carbohydrate, but Codex recommends available carbohydrate. Total sugars, fat, saturated fat, and sodium. So pretty much standard what we see all around the world. And of course, if you're making a claim, you have to list the nutrient that you're making a claim about in that Nutrition Information Panel. And their definition of sugars is nice. It's very simple. Sugars means all monosaccharides and disaccharides present in food. Unfortunately, if we go to Australia and New Zealand, we get a very convoluted definition of what added sugars are. And you can see, first of all, we exempt allulose from the mono and saccharides and disaccharides, so that's something I'll circle back to a bit later. We include starch hydrosylates, glucose syrup, maltodextrin, and similar products, so oligosaccharides basically. but it does cut out the polyols, which I'll touch on again briefly later. And there's a little footnote there about what sugar. It doesn't include sugar. Here is the list of, I guess in more layman's terms, what sugar is composed of as well. So as I said, a very convoluted definition of what sugars are in our Food Standards Code. Contrast to Canada, very much in line with the Codex, and I've just put the websites where I got a lot of the information from. A lot of this information is what's called the grey literature. So you're not going to find this on PubMed or in journals. It's on these regulatory bodies' websites. So it's important if you want to go back and follow these up, these are the main sources. So they're often legal documents. They're not particularly consumer focused or friendly, but that's where most of the information comes from. So Europe refers to sugars as all monosaccharides and disaccharides present in food but excludes polyols, right? So thinking about that WHO definition, that's an important differential. USA simply says the sum of all free mono and disaccharides such as glucose, fructose, lactose and sucrose. So again, more in line with the Codex. Now added sugars we discussed an awful lot when I presented 2 years ago. So I'm not going to go into great detail, but at that point in time, Australia was considering adding added sugars into our nutrition information panel. So they had this proposal, which you may or may not remember, but again, it was quite convoluted. And I think getting back to what Tassif said, they're really actually not talking about added sugars, it's added sweeteners. So they're trying to lump everything together under sweetness rather than sugars from a molecular perspective. And again, so it included what I would consider to be maltodextrins in there. So not really in line with what Codex Alimentarius is talking about. And here was the draft nutrition information panel that they were proposing. And at the last meeting, I was really trying to get information from everybody to try and see how we could make this consistent globally to help consumers. But not long after that, a particular company called Hartwood Strategic undertook consumer research on behalf of our food regulator, Food Standards Australia and New Zealand, to really help inform the decision-making process. And I think that's one thing that our food regulator does very well. For important issues, it will actually go out and ask the intended recipients, the consumer, how this actually makes them think about the food and will it help with their food decision-making processes. So they did 10 90-minute focus groups with consumers in Australia and New Zealand. Some of them had university qualifications, others didn't. So it was a really reasonably representative survey of the Australian population. And here's some actual quotes, and I've just put them in here to give you an idea of the very polite way they said that we're not doing this, which they actually haven't come out and said that publicly. So I'll read them out. If the goal of including added sugars in the NIP is to better support decision making according to the dietary guidelines in both Australia and New Zealand, then the changes as implemented and tested in the consumer research were unsuccessful in this. On balance, the inclusion of an added sugar line in the NIPs tested may result in less healthy consumer decisions, and these research findings point to the need for serious consideration of whether added sugars information should be included in the NIP, and if so, how, given the risks that perverse outcomes in consumer behaviour are possible if an added sugars line is added as tested in the focus groups. Now, there's a 60-page report that backs this up, but when the food ministers in Australia got this, they said we're not putting added sugars on the nutrition information panel. And what they've decided to do, in fact, is to review the entire nutrition information panel itself to see whether we can do it better, because consumers really don't know. And I'm not aware of any US-focused consumer group data. I'd be interested to hear if anybody has seen anything on that. So moving on. So in Canada, most packaged foods must have a list of ingredients, and the sugar-based ingredients are listed together. And I did talk about this 2 years ago, so I'm not going to go into it, but it is a very comprehensive list of what they consider added sugars to be. And then they're in their mandatory ingredient list, they have to group them all together, and you can see here this example where they've got them all together. So, that sort of makes sense to me. For those who want to avoid added sugars, they can find it there without having to put an extra line in that nutrition information panel. In the USA, again, I covered this 2 years ago, and their definition is fairly logical to me. It's not as convoluted as the Australian or New Zealand one. And they have, of course, implemented the added sugars, as it's a separate line item underneath total sugars, and they've also got the added benefit, I think, of the percent daily value, which was something that I thought in Australia, if we had added sugars, that we should put the percent daily value. So at least it means something to consumers, a sort of a benchmark. So, yep. Sorry, now, and Torsif talked very nicely about rare sugar, so I was very pleased, and I asked Olivia to put me on at the end after you so that people knew what I was talking about. And of course, so you've presented very nicely that some sugars are metabolised differently than traditional sugars, and not associated with dental caries. You didn't mention that, but that's the overall evidence. May provide less energy and lead to lower postprandial glucose and insulin levels. So allulose you've mentioned. That is singled out in Australia and USA regulations, but nowhere else that I'm aware of at this point in time. But there are others. There's the D-tagatose and isomodulose that you talked about. So allulose must be included in the amount of total carbohydrates, but not in added sugars, which I think is really quite interesting. But the D-tagatose and isomodulose must be included and disclosed as added sugars. So again, we're sort of dealing with things slightly differently. And this actually is what happens in Australia and New Zealand as well. So we seem to be following the US lead in that respect, but I think the rest of the world's not doing this sort of thing yet. Polyols, we haven't really talked about, as I said, but Codex Alimentarius does have a section on it. So again, this was from 1995, but it was updated in 2024. So this is updated regularly. There are very common ones there that you'd be aware of that have acceptable daily intakes. I'm sure most people know what that means. And they list the ones that have been approved for use, generally with good manufacturing practice, which means you can have just enough in there to achieve the effect without providing any adverse effects. And obviously it's in the industry's best interest to just put in there enough to get the benefits without spending extra money on ingredients. So this is the Australian and New Zealand definition. I mentioned it already. So it does list very specific polyols there that are permitted. And there is a mandatory warning statement, basically that it can cause excess wind and laxation. And allulose is also one of those that are required to have this warning statement. I don't know whether that's the case in the US. In Canada, it defines what they are. It acknowledges in the documents that are online, if you know where to look for them, that it can cause adverse gastrointestinal discomfort and laxative effects, but it doesn't require a warning statement, which was something that was kind of fascinating for me. So what instead, it can ask you to put the amount in there in the nutrition information, your nutrition facts panel, but it's really up to the individual to work out whether having too much of that product is going to cause any of those adverse effects. And I think that's quite a leap of faith. I don't think most people know what these products are, and adding an extra line to your nutrition facts, I doubt, is going to trigger in the average person, oh gee, I got a really bad, sort of diarrhea after I ate that packet of lollies. They're probably not going to put two and two together, so I thought that was fascinating. Europe is quite similar. Again, they list the specific polyols. It's a very similar concept to the good manufacturing process. They use quantum satis as a synonym, but they do require a warning statement if it has more than 10% of added polyols that it may cause these excess production of wind and other laxative effects, basically. The United States, they define them as saccharide derivatives with the hydroxyl group replacing a ketone or aldehyde group, so this is very scientific, but they're listed by the FDA as generally recognised as safe. There must be a statement of the number of grams of those sugar alcohols voluntarily declared on the label when a claim is made about that sugar alcohol, and the amount should be declared. But also you can name the specific sugar alcohol in there and put that amount in there as well. And if they contain specifically sorbitol and mannitol, then there must be a warning that excess consumption may have a laxative effect. Now, last, and I think probably the most difficult one, is the non-caloric sweeteners. So Codex Alimentarius does list all of those that have been reviewed, and as I mentioned before, they call them intent sweeteners, in contrast to WHO, that calls them non-sugar sweeteners. So I think that's really interesting and something that we probably should be talking about. Australia has quite a bit of information in its food standards. The Schedule 14, technological purposes performed by substances used as food additives. It defines intense sweeteners that replace the sweetness normally provided by sugars in foods without contributing significantly to their available energy. And I did mention this last time, and we did talk about it a little bit, but I thought I'd include it again. Because of a lot of the misconceptions that you add in as much intense sweetener as you want, and it makes people addicted to that food, basically. And that's part of the narrative that a lot of activists put back against, any kind of sweetener. But you can't, because of course you have to bulk it out. In a drink, it's bulked out with water. In solids, it's usually a starch or other bulking agent, and you can only do it to the equivalent sweetness of the sugars that you're replacing. Now that's in Australia and New Zealand. After the last ICQC, Susan Roberts and a few others have looked around the world. We asked all of our contacts. We can't find any evidence of any other nation's food standards limiting the sweetness. I thought that was interesting, that Australia and New Zealand seems to be the only countries that limit the sweetness of foods. But of course we know Keys de Graaf and other great researchers have looked at that whole sweetness issue, and that's being published shortly, and I think that counteracts that argument anyway. Our Schedule 15 lists specific food additives. There's commodity standards, and you can see that there are a whole range of those that you'd be very familiar with. Aspartame or aspartame sulfane salts must of course have a warning statement for those people with phenylketonuria. Canada has a process, and I might add that Australia has a similar process as well. New food additives are only permitted after a safety assessment. They have a list, as you can see here is just an excerpt of it, of those that are permitted. And again, there's the warning statement for those that contain phenylalanine. So it doesn't single out the salt, but I assume it captures both of them. Europe, yes, so ESFA has a very detailed process. It looks at the acceptable daily intakes, the permissible amount. There's a warning statement for phenylalanine. And they're re-evaluating each of the food additives. And this list is available online if you know where to look for it. I think it's quite important for people to realise that so the organisation is going through each sweetener on a regular basis, reviewing the science and changing permissions if it requires that. So again, I think that's something that's really important, that consumers don't understand that we're constantly looking at the science behind these and the safety, and if there are any signals, we'll either reduce permissions or we will prevent them from being used in the food supply. USA, we've already, I think Tarsif talked about the grass. So there are 6 high-intensity sweeteners that are approved: saccharin, aspartame, ACE-K, sucralose, neotame and avantame. So they're less than what's available in Australia and New Zealand and many other parts of the world, so it's a much more reduced list. And then they do require the warning statement for aspartame, for phenylketonuria, and then there's the GRAS status for what probably aren't called artificial sweeteners, at least by consumers. So they're considered to be natural sweeteners and the like, and this is a bit of source of confusion as well. So steviol glycosides, of course, and the more recent monk fruit as well. So they're given GRAS status. So in summary, Codex Alimentarius recommendations underlie most nations' regulation of sweeteners, but of course they're not following it exactly, and there's different interpretations in different parts of the world. And the in particular one that stands out to me is the oligosaccharides, and I think that's something we should be talking about perhaps this afternoon. Added sugars are only mandated in the USA's Nutrition Facts panel. Canada lists them in the ingredient list, and Australia's decided we're just not going there. It makes people choose really strange foods. And I think it's partly because they're mixing up added sugars with other sweet things, and in the eyes of the consumers it's just confusing them, like honey for example as an added sugar. They just don't get it. Most nations follow Codex guidelines for polyols, but there's different variants listed. Most mandate warning statements, but not all do, and some of them leave that up to the consumer, which I think would be problematic, I suspect. I should add that I'm a clinical dietitian and I see patients every week, and I know my average person is not going to know what a polyol is and what to look for. Most nations follow Codex for intense sweeteners. Not all are permitted in all nations, so there's differences around the world. Some are only allowed in specified amounts based on GMP, and it's only Australia, and sorry New Zealanders, I missed out, is Australia and New Zealand that limits the sweetness of sugars. And I think that's interesting in itself. That's something maybe we could be talking to Codex about if we thought that was important. So overall, while based on the Codex, regulations of sweetness sweeteners varies around the globe. Again, this has implications for research. When we're looking at these in papers, if they're done in a specific country, we're assuming we're all talking about the same things, but we're not necessarily doing that, particularly those observational studies. Industry, of course, who are trying to produce products for global sale and distribution, it's a headache for them, I would imagine. Governments, and of course the consumers. I mean, if you go from one country to the next, you're assuming it's the same kind of products that you're looking at, but it's not necessarily. And particularly where you import food from other countries as well. So I think global standardisation will have benefits for all stakeholders, and I'd like to suggest, based on our earlier discussions yesterday, that this is something we perhaps take to Codex Alimentarius, along with suggestions for adding dietary fibres and, of course, glycemic index into those standards. And then we can go to each country's regulatory body rather than doing it the other way around. So thank you for listening, and look forward to question time.